have sleep apnea? As defined by sleepapnea.org, obstructive sleep apnea is an involuntary cessation of breathing that occurs while an individual is asleep, and if left untreated, it can contribute to serious and life-threatening consequences. Sleep. Sleep is so important in order for us to stay healthy, and lack of sleep can have detrimental effects on our lives. It is estimated that over 1 billion people in the world suffer from obstructive sleep apnea, also known as OSA, and most are unaware that they have it. Sleep apnea is a sleep disorder that involves cessation or significant decrease in airflow in the presence of breathing effort. It can have major repercussions on a person's overall health if not addressed accordingly, and contribute to a decreased quality of life. So how do you know if you are at a high risk of having sleep apnea? Well, there is a few things you can look for by doing a basic self-screening. Basic sleep apnea self-screening. This basic self-screening includes the most common signs and symptoms associated with obstructive sleep apnea. If you answer yes to any of the following, it is advised that you get a further evaluation by a certified sleep medicine doctor in order to rule out sleep apnea. Do you snore or wake up gasping for air? Snoring is one of the primary signs of obstructive sleep apnea, especially if accompanied by gasping of air, making it 70 to 95% common amongst those who suffer from obstructive sleep apnea. But it is not to say that everyone who snores has obstructive sleep apnea. The prevalence of snoring in the general population varies widely, from 15% to 54%, mainly because most studies rely on subjective reports. Snoring alone can also occur when a person is completely exhausted or has a stuffy nose, but when it is accompanied by gasping for air, it increases your chances of having obstructive sleep apnea. Do you have enlarged tonsils and adenoids? Enlarged tonsils and adenoids are a predictive marker for airway obstruction, as they contribute to narrowing of the upper airways. According to sleepfoundation.org, surgical removal of enlarged tonsils and adenoids alone has demonstrated improvement in the severity of obstructive sleep apnea in children, and children who had these surgeries have experienced improvements in behavior, quality of life, and other symptoms. This is compared to children without these surgeries. Now, why is this not the first line of treatment for all of those suffering from obstructive sleep apnea? Well, the answer is that not all persons suffering from obstructive sleep apnea have enlarged tonsils and adenoids. Are you a mouth breather? Mouth breathing has many repercussions associated with it and can further contribute to obstructive sleep apnea or make your apnea worse by further increasing airway collapsibility and nasal resistance. The more a person breathes through their mouth, the more congested they'll become, and the more difficult it can be to treat their apnea. A mouth-breathing individual will also tend to carry their tongue low and forward on the floor of the mouth, and this abnormal tongue position can further contribute to airway impingement, as it prevents the muscles located in the back of the throat from being properly toned, hence further contributing to airway collapsibility. Do you have a tongue tie? A tongue tie, or tethered oral tissue, is when the lingual frenum, which is the string located on the underside of your tongue, is restricted and impedes proper movement and function of the tongue. This restriction is associated with a myriad of cascading overall health effects and has been linked to obstructive sleep apnea. These restrictions can have a tremendous impact on the orofacial development, hence impacting the proper development of the airway. A study conducted on a frequent phenotype for pediatric sleep apnea, short lingual frenulum, stated that a short lingual frenulum left untreated at birth is associated with obstructive sleep apnea syndrome at later age, and a systematic screening for the syndrome should be conducted when the anatomical abnormality is recognized. Do you have excessive daytime sleepiness? This is often a sign that you did not get a restful night's sleep, and can also be a sign of obstructive sleep apnea. As with sleep apnea, sleep is continuously being interrupted throughout the night due to arousals from snoring or gasping for air. Sleep is reparative for your body, and if we don't get enough quality sleep in our system, all sorts of problems can arise. Sleep deprivation has been associated with various medical conditions such as diabetes and heart disease. Therefore, it is essential to make sure that we are getting a good quality of sleep. Do you suffer from high blood pressure? High blood pressure is often associated with obstructive sleep apnea, as during an apnea episode, there are sudden drops in the blood oxygen level. During this sudden drop in oxygen, the brain sends a message to the blood vessels to increase the available oxygen to the heart and brain so that the body can continue functioning. This increase in blood flow puts added pressure onto the blood vessels' walls, resulting in even higher than normal blood pressure readings, and it places extra strain on the cardiovascular system. A study of 3,000 adults determined that those who slept fewer than 6 hours a night had double the risk of stroke or heart attack as others who slept up to 8 hours, possibly because too little sleep exacerbates other health conditions, including high blood pressure. Have you been diagnosed with diabetes? According to a study on sleep apnea and type 2 diabetes, obstructive sleep apnea alters glucose metabolism, promotes insulin resistance, and is associated with development of type 2 diabetes. Therefore, having type 2 diabetes can be a potential sign of obstructive sleep apnea. Are you overweight or have a large neck size? Being overweight or having a large neck size can also increase your chances of having obstructive sleep apnea. Extra body weight contributes to an increase in pressure on the upper airways, making it more difficult for the person to breathe, thus resulting in airway collapsibility and decreased neuromuscular control due to the fatty deposits. Do you have a recessed jaw or crooked teeth? Having a recessed jaw or crooked teeth can also place you at a higher risk of having obstructive sleep apnea. A study conducted on orthodontic view in the diagnosis of obstructive sleep apnea found that having a retruded mandible or a recessed jaw puts a person at a higher risk for having obstructive sleep apnea because a recessed jaw is a consequence of a backward position of the tongue and disturbing the cervical region or region of the neck. Are you experiencing mood changes? Irritability, depression, anxiety, and lack of concentration are among some of the psychological changes that can be experienced due to lack of sleep and obstructive sleep apnea. A study conducted on prevalence of obstructive sleep apnea in suicidal patients with major depressive disorder found that approximately 14% of the participants suffering from major depressive disorder had obstructive sleep apnea, and 52 out of the 125 participants had treatment-resistant depression. Obstructive sleep apnea has many detrimental overall health effects, and it is essential to address it at its early onset. This self-assessment helps you with the identification of the most common signs and symptoms of obstructive sleep apnea. If you or someone you know are experiencing some of these symptoms, a thorough evaluation from a certified sleep medicine doctor is advisable. Check out our website to get our free downloadable sleep apnea self-assessment checklist today.